Yeah, I think, look, when we talk about the public health crisis of addiction and substance use disorder, we understand that people are, and we are vehemently under resourced for treatment. And one of our goals, part of the president's strategy, is to get people more treatment. Now, when people begin to get treatment, we want to make sure that people are then in recovery. But recovery generally is a lot more than just treatment. Recovery is about four principal things. It's about your health, not only your physical health, mental health, but also your overall health. Other things that might be going on with you, diabetes, hypertension, other things. It's about your home, rebuilding those connections with your family and reestablishing those. It's about your community, connecting back with your community. And it's about purpose, a purpose in life, finding that purpose. So when we look at that recovery, to have sufficient recovery, we need to have resources, and that's what we're working on, to from housing to transportation to childcare to a job. All of those aspects are important because here's the bottom line. If it remains easier to get illicit drugs in America than to get treatment and recovery, we're never going to be able to solve the problem. And that is so true in West Virginia as well. So what we've got to do, and I think we've been in a discussion today, a great conversation about fantastic stories where we got to have a recovery-ready workforce and recovery-ready businesses, and ultimately a recovery-ready state and a recovery-ready nation.
So it goes beyond just the recovery homes themselves. You're talking about an entire paradigm of recovery. It's across the board.
Yeah, and why? The question why? President Biden in his State of the Union earlier this year recognized that 23 million Americans in recovery. And that is a large number. 23 million Americans in recovery, and guess what? 2 out of 3 of those are actually employed. And most of those are employed full time. So when we have so many Americans employed, it's often a myth that people in recovery may be completely unemployed. The fact is that the majority of people in recovery are employed. We just need to make sure that we're providing support, removing the stigma that often goes with recovery. And we hear about that all the time, including in our state here in West Virginia. And we've got to remove that stigma of someone in recovery and provide the resources of housing, of transportation, of economic opportunity, as well as things like childcare, food insecurity, and those type of things. It helps someone and so many folks remain and maintain recovery and be proud, find that hope and purpose in life with which you can actually, and I've seen people 10, 20, 30, 40 years in recovery. We have right now at least 2 cabinet secretaries in the United States federal government who are in recovery, Labor Secretary Marty Walsh and Interior Secretary Deb Haaland. So we have people in my office who are in recovery, and they're great advocates, great people.
Words of experience too.
Exactly.
From those people.
Exactly.
How important do you think it is certification? Maybe address the importance of certification of these sober living homes that we see around West Virginia, because I've heard from 2 people who have certified businesses who are saying that homes that open up, Timier's recovery house could open up on the corner without certification, and according to these people from the jails and from hospitals, people are being referred to these non-certified homes. How important is it for these homes to get proper certification?
Yeah, so certification is really about standards, having levels of standards where people, vulnerable people oftentimes, are treated with respect, treated with standard of care, and not exploited unnecessarily. And having those facilities that are certified means that we have standards of care, standards to that recovery facility, housing facility. That is true in healthcare, that is true for your business, that's true for licensing. What you do is we get a driver's license, that's a standard. So I think we're moving slowly, it'll take some time, to a place where states like West Virginia will have these standards, and it is to protect not only the businesses, but more importantly, the people who are so at a vulnerable place in their life when they're going from treatment to recovery. And we need to make sure that they're meeting the highest standards of care when it comes to recovery placements.
So you can understand their frustration, the people, somebody who runs a business that is certified, their frustration with being lumped in with everybody, and that's what, when in asking these two guys, they've said, that's our frustration. We are doing it the right way, and we feel like the public is viewing us in the same way they're doing these non-certified homes, and I guess maybe that's their point of why they're craving certification.
Well, I think it's going to take a lot of education and removal of stigma just generally in the public to understand to have these certification of facilities is an important piece. Like I said, we do that for every other business. It's a business practice to have standards of care no matter what businesses you're in, to get a license, to work with your state facility. And I think we're slowly getting there, and we are in a transition period as a state and as a nation. But I think it's important that we look after people, we look after the vulnerability of individuals, and we provide good quality, whether it's housing services, food insecurity, transportation, childcare. It's really important for us. And it is important that we follow the rules that are being formed.
Considering the number that you talk about, 23 million people in recovery right now in the U.S., do you see this as kind of a parallel to what our country went through with the deregulation of mental health facilities in the 1980s, where these group homes were set up in people's neighborhoods, and there was a backlash against that. People said, I don't want that, not in my neighborhood, was the phrase that was heard all over the country. Are we in that phase right now, or that's why this certification is so important?
Well, I think stigma is something that has pervaded our communities and all across the globe forever. I mean, 100 years ago, there was a time when cancer was so stigmatizing disease. People didn't talk about it. You often didn't tell as a doctor, your patient, they had cancer because they were often left alone. Now look where we are today. Today, when someone is diagnosed with cancer, you have a lot of compassion for them. You ask if they can help you. And so the highest number of investments have gone into the research and development of cancer drugs. We want to eliminate it. We are treating it with compassion. We need to do the same thing with addiction and substance use disorder, and mental health for that matter. So it's very important that every urge we have to stigmatize mental health and substance use disorder diseases, we fight that urge as a community, as a group. And we make sure that we treat people with the very same humanity like we treat our neighbors and our own family members. And only then can we surpass that really difficult stigma that often prevents us for helping people and giving them a compassionate care that they so deserve.
What's been the toughest thing for you personally in the job? If you could wave a magic wand and fix a problem right now when it comes to what you're doing and what the problem is that's out there, addiction and recovery, what magic wand would you pull and fix the biggest problem?
I think the toughest thing for me is to be able to understand and know that there's an American dying every 5 minutes around the clock. Mm-hmm. And it's race against time for so many people that we're losing constantly. So what I've been trying to do is make sure more communities, more states and localities are aware that there are medications like naloxone or Narcan that's available, because 3 out of 4 people that are dying or passing away is actually because of opioid-related overdose death. It's preventable. We need to make sure people are being saved, because every life is precious and worth saving. Only then can we get folks into treatment and recovery once we're able to save those lives. And I tell you, we're losing 100,000 plus people a year, 1 every 5 minutes, and it's outrageous, it's tragic, and frankly, it's unacceptable.
Do you believe that we are in the state of West Virginia where maybe we've turned the corner before other states and before other communities have, simply because the problem was so severe and we got a jump on it?
I think West Virginia is doing a lot of good things and a lot of things right. For example, Dr. Christensen, director of ODCP, is working to make sure that naloxone is widely available. I talked to a number of people at University of Charleston School of Pharmacy yesterday that are working to make sure naloxone is available across the entire state. Now we know when we surge naloxone, deaths go down. We also know so much efforts of making sure that we have treatment available, including telehealth, phone consultation treatment. We also know that There are businesses we heard about even today that are working proactively to help people in recovery, because getting people to stay at work while they're in recovery is so much more inexpensive than to be punitive about it. So that recovery-ready workforce, recovery-ready state is so critical. If nothing else, economically, it's so critical, because we're losing way too many people, especially our working age population, every day around the clock in this country. And there's lots of things that West Virginia is doing that could be stood as national models. And we're really looking at that right now. We're working very closely with the leaders in the state to see what works, and let's make sure we talk about it and we expand what works to further all the counties in the state and across the nation.
I heard you use the word stigma, and that is something that is tough to overcome when it comes to public perception. That stigma. It's hard enough for someone just to get through the recovery process, let alone having to deal with the social aspects of stigma. How is, from my standpoint, it's like, it's almost impossible to get over that. But you guys, I'm sure, have been looking at this and studying that idea of society and trying to overcome stigma. How does it happen? How do we move forward as a society and try to put our arms around the problem and around the people who are affected?
I always remain optimistic because we have overcome stigma in so many conditions before as a nation, as people. And this is one also we must overcome in order to not only save lives, it's as simple as that, but also to get our economy back to working. And part of that's making sure, when we know that we're losing about $1 trillion of economy a year in this country to substance use disorder, up to a quarter of the workforce, the labor force participation during the pandemic has been lost because of substance use disorder. It's time that we look at people as human beings, as ones that deserve the dignity of a human being. And once we do that, we start to remove stigma. Yet we hear all the time, and today we heard some stories about how there were very qualified, trained, excellent candidates for a job at various places, and they were asked to, work there. But as soon as they found out that this person had, for example, a criminal record or a person in recovery, they were never heard from again from their employer. We also heard that was, unfortunately, the employer's loss, because these are fantastic individuals that have found employment elsewhere and doing a great job. So we have to recognize that stigma only hurts us as individuals, as communities, and as businesses. So it's important for us to look at removing stigma, especially when we're talking about 23 million Americans. The president has called on all of us to celebrate people in recovery, to move forward as a nation, and this is part of his unity agenda, because the fact is that this crisis doesn't care about your politics. It doesn't care if you're rich or poor. It doesn't care if you're urban, rural, black or white. It is indiscriminate in its ability to cause damage to people, to families, and to communities.
Again, another part of that, before people can even get to that, we have problems with, and they go hand in hand with addiction, problems with homelessness and food insecurity. So before we can even get to that point where we try to erase the stigma and get people into jobs and get people into proper recovery, we have to find a solution for homelessness and food insecurity. I know that's a lot to throw on you right now, but how do we do that as a society?
I think first of all, we have to recognize that issues like mental health, issues like food insecurity, transportation, homelessness, these are all parts of the issue why people are suffering from substance use. And in order for us to consistently help people get into treatment and recovery, we have to look at these aspects as well. And that's exactly why we're working, and the president's strategy really addresses that. It addresses not only the reasons to expand treatment, but also look at elements like these. We're working very closely with the Department of Housing and Urban Development, or HUD, to make sure that the funds that go out of, recently we put out $365 million of grants, that we're also looking at addiction and substance use disorder when we're talking about housing. Same thing goes for food insecurity, transportation, child care. These are challenges that are important to someone who gets into treatment and recovery. And by eliminating these challenges, what we do really is make it easier for a person to stay in recovery, get their treatment, and find those balances with health, their own health, their home, their community, and that purpose in life. And that's exactly the way we're going to get out of this crisis, is to make sure we're helping one individual at a time, but focus on individuals and treating people as humans and with dignity.
In your job, do you wish that would you like to see an increase in funding from lawmakers in Washington towards this issue, and then even distribution across the states that really, really need it?
Yes, I'll tell you. President Biden has proposed a budget that significantly increases, has a historic and unprecedented funding increase in this budget. In his drug budget, he's asked for an increase of $3.2 billion from $40 billion base budget. Reason he's doing that is he understands that 75 cents on every dollar of that increase is going towards prevention, treatment, and recovery. And he's asking Congress to act on that, because that's the money that's going to come back to states like West Virginia, to our communities right here, and help people with resources, with the ability to get the help that they need. And he's promised the people across the nation that we're going to get you the resources you need. We're going to beat this crisis, and we do need Congress to act on that.
And will there be oversight then on how that money is distributed to states, and what the states then are required to do with that money, so it's not wasted?
Absolutely. I think it's important to understand that we've got to have solutions that are driven by evidence and data, and we work in tandem with states, meaning in partnership. We provide guidance. So far, my office has provided state model laws around naloxone, around settlement funds, around service programs, around deflection programs, which is a type of diversion program in lieu of incarceration, getting people to help with mental health disease and addiction, because we can't incarcerate our way out of the problem either. And so we're working to find and work with states and local communities to find those solutions, which may not always be the same solution for everyone, but we do think there are very simple parameters that we can do and work with states to find those customized solutions. And that's where the President's been really forthcoming and leading, because we have a historic number of people dying, and that's why he's matching it with an unprecedented budget increase proposal to make sure that we're helping communities.
Finally, is there something about your job that you absolutely love since you've taken this opportunity? And then is there something you'd like to tweak just a little bit and maybe change something? What do you think so far?
I think my experience in West Virginia, both at a local level and state level, I believe has prepared me well, and the passion to make sure that at one point we have so many Americans unnecessarily dying around the clock, to be able to impact with a sense of urgency. And it is also really good that it is President's top and urgent priority at this time to do that. So it's an important part to me that I'm part of a team, part of an administration that is working to literally save lives every single day. There's very few places where you have that opportunity. In my profession as a physician, that's what I did for 25 years. Now I'm able to do that at a national level. I also think that there's a lot of progress we can make. We've made significant progress over the last year and a half in terms of getting more telehealth, more take-home medications, changing policies to the extent possible to make it easier for treatment access to happen. But there is so much more work to do. There's so much more work to do because people are still dying at an unprecedented rate. So we have to be real and frank about that. We're doing a lot of work, but still there's challenges that remain and work that remains to be done.
And COVID, clearly a challenge, because we heard about so many more losses, loss of life during COVID, because people weren't able to seek the proper treatment. They were holed away inside their homes and everything with quarantine. But what were our lessons that we learned during COVID that are actually now starting, or that you see either are paying off or will pay off? Those I heard somebody refer to it as we learned a lot. They called them COVID blessings.
Right.
We learned a lot from it. Where do you see us going forward from what we learned?
I think we've learned very simply and clearly that we've got to expand treatment. We got to meet people where they are, build trust and engagement, and help people. We also learned that it is time that we are continuing to resource the problem. But at the same time, we know that the president has laid out a clear pathway in terms of a strategy to address this. If we implement that strategy, we'll be able to save tens of thousands of lives. It's very clear to me. If we continue not to do that or continue to do what we're doing, we're going to lose a lot of lives. So American lives are at stake right now, and time is not on our side. So what the important piece is that we're making progress, consistent progress, but those lessons, we need to make sure that we're continuing to make progress on things like telehealth, things like ability to get treatment to people, have universal access to treatment as early as possible, and help people most vulnerable with a lens of equity, making sure that people who need it, most vulnerable individuals, are getting the help as well, but at the same time making sure that we've got solutions that we're working towards and understanding there's a lot more work yet to be done.
Is there anything else you'd like to address? Or?
I think that's it. Tim, appreciate it.
What would you like to take back to Washington? What lessons from this trip to West Virginia? Medical, they always talk about continuing medical education. This is kind of an education for you coming back home. What do you hope to take back to Washington?
Well, first of all, it's great to return home, and this is like family to me, so it's big homecoming. We've also been learning a lot. We've learned today the role of economy and jobs in recovery, why that's important. We've also met with law enforcement officials earlier today, talk about why that's important, because we have to continue to work at the intersection of public health and public safety to address this crisis. We're going to be talking about prevention tomorrow, and it's going to be important for us to discuss why prevention, especially in the kids, is the best return on investment we can have, because kids are the future of the country. And for our nation, we've got to have children that are either not using drugs or we're delaying significantly the use of drugs. Those things are very important, and we've got some great programs here in West Virginia that are serving as models.